we made it through half of the anatomy lectures. So now we're back. This is, technically it's week 6, but it's our 5th anatomy lecture. Last week we had the midterm. You have your midterms back. If you have any questions about your midterm, we'll certainly go over them whenever we have some spare time. The focus of this week's topic is going to be the pelvis and the upper leg. So we're moving down the body. Next week we're going to have the lower leg and the foot. And then after that we're going to move up to the skull. And last week finished off with the facial features and specific little tidbits of anatomy to look out for in the face. So this week, focusing on the pelvis first. We'll do the pelvis and then we'll build on top of it with the leg. Now the bones we're looking at today are going to be the pelvis, and within the context of the pelvis we're looking at sort of 4 different segments here. We've got the ilium here up top. If we imagine the pelvis is this butterfly shape, the ilium is the large wing portion of that butterfly shape. The ilium can't be seen, but it's relevant for its bony ridge at the top, the iliac crest or crest of the ilium. And you can actually feel it most of the time. Just right in front here, it's this bony projection that's running kind of along toward the back. That's the ilium or the iliac crest. And we have a lot of muscles attached there. It's a good leverage point. Underneath that we have the pubis in front. Can't really be seen. The small portion of the wings of the butterfly is the ischium here. It's kind of your butt bone right and back. Seen from the side, you'll notice that the ischium actually sort of loops backward, whereas the pubis loops forward. So if we imagine it three-dimensionally, it's got sort of a loop handle at the bottom and then the flat, broad ilium at the top there. In back, the third piece of the pelvis, which isn't technically part of the pelvis, it's the sacrum here, the bottom part of the spinal column, where the last little bits have fused together. The sacrum is your tailbone. You can just feel that right in back there, the tailbone. Beyond that, the bones we're looking at this week are bones of the legs. So we're looking at the femur. And again, that femur is the longest, strongest bone in the body here. Just distal, the distal end of the femur is the patella. Patella is our little knee bone. So that's all the bones we're going to look at today. The patella you can feel. The femur you can only feel in one spot, which is this lateral head and the proximal end. That's the greater trochanter. That's our name for it. And we can actually feel it and often see it in the model. It's a bony projection of the leg. It acts as a good landmark to launch off of for measurements. So if you get those greater trochanters figured out, you can figure out the tilt of the hips. So we can launch and verify the pelvis in front, the iliac crest here, and then the greater trochanters on the side. And if you go from greater trochanter to greater trochanter, we'll get that angle or tilt that we often need at drawing. Let's go ahead and talk about muscles starting at the top and working our way down. Well, the only muscles you need to really know that are centered around the pelvis are going to be the glutes, which most of us are already familiar with. We have gluteus medius and gluteus maximus. And the glutes are located on the back side, if you were aware. The gluteus medius, just running along the top side of that iliac crest. And then the gluteus maximus is a large muscle that makes up the bulk of your body there. So you have the gluteus medius and gluteus maximus. That's it for the pelvis. So we can move just straight on down to the leg. Now the leg is going to be set up a lot like the upper arm. We've got 3 prominent muscles in front, 3 prominent muscles in the back, and then a few side muscles to help with our abduction and adduction. Now the leg does have quite a bit of adductors that are right along the center line here, attached to the bottom of the pelvis and the inside of the femurs. But we're not going to have to memorize all of them. If you know they're there, you can try to find them, but often they're not as pronounced as you might think. Especially with adduction, our legs are coming together. and we're not going to see them bulging as prominently with adduction because our legs are going to be closed. But we can look at the front side of the leg for some nice substantial bulges there. Now the front of the leg has one prominent muscle that's running down the center, and that's called the rectus femoris. And that should sound kind of familiar. You know, when we talked about the chest, we talked about the rectus abdominis. Rectus being front, abdomen being, or abdominis being abdomen. Here we have rectus meaning front, femoris meaning femur. So rectus femoris is the large, bulky muscle running down the front side of the leg. The sides of the rectus femoris, flanking it laterally and medial, are the vastus muscles. And now we'll refer to them as vastus lateralis and vastus medialis. That should make a lot of sense. Vastus medialis should run closer to the midline of the body, so it's actually going to be a little bit toward the distal end of the femur down here, bulging prominently right down here. The vastus lateralis is going to be on the outside, and it's going to run more along the entire length of it. So that's going to give us some shape to the leg. So we have to recognize that the leg is not just a tube, you know, coming straight down with a knee down here. You know, that won't make a good leg. We should first start with the construction of the bones and how they're situated, and then we'll build some muscles on top of that to make a leg that looks legitimate, believable, and has a fair amount of curve to it. So the first thing we'll do is start with the pelvis here. So we have this sort of butterfly shape bone here with a spine running up. That's a very simplified pelvis. Abridgment does have a lot of nice pelvis drawings in the book. I encourage you to go ahead and work your way through them, draw a few pelvis if you have some spare time. So then we look at the femur attached to it. Now with the femur, we've got the greater trochanter here, just attached, projecting here, creating that nice far protrusion, widest point of the legs there. Now keep in mind, the femur does not run straight down. This is not how our legs are situated. If it were, then all of the weight of our upper body would just fall directly between our legs there, and then it could cause some snapping. Our legs would not be able to support our upper body weight if they were positioned directly straight down. So what you'll find is the architecture of the body, the legs, is quite fascinating. To support all of our weight, it's angled inward a slight amount, so that the weight is distributed evenly throughout the body, about a third and a third. So our kneecaps are falling at about the third points to make sure that we don't snap our legs. So this is how our bones are situated. They're angled in slightly. So let's go ahead and just focus on one of them, and we'll build the muscles on it there. So we talked about the rectus femoris running straight down the center of the leg. Now keep in mind, just because it's running straight down the center of the leg does not mean it's just running up and down, because our leg is angled. So it's running along the bone here. So we have this bulge that's coming sort of like this. Bulgy muscle of the rectus femoris. Now the vastus muscles, we're going to build on the sides of those. So vastus lateralis is going to be on the outside of the leg. So we're going to see it running on here, along this outside. And then it joins up with this common tendon down here, conveniently called the common tendon of the patella, where our muscles feed into. And then the vastus medialis is going to run along the inside. It's going to be kind of a teardrop shape look down here. So these are our main muscles of the front of the leg. We've got, let's zoom in some different colors so we can see. We've got our rectus femoris running down the middle there. Vastus lateralis running along the outside. And then vastus medialis running along the inside. So notice it's giving us this nice form and shape to the body, or I'm sorry, to the leg. It's making it not look just like a straight tube going down. Now this isn't quite the whole shape of the leg because we have those adductor muscles that we mentioned, and the adductor muscles are coming out here. And here, running all the way along. There's 6 potential little muscles that you might be able to see along the inside of the leg. But like I said, in most cases, they're not going to be readily apparent. You're really going to have to seek those out to see them. And then along the inside of the leg is a muscle that we will become aware of, and it's a very long muscle that's sort of evening out some of the starkness of all these other muscles, and it's the gracilis. And that is mentioned in your Bridgman book as a muscle that you are going to end up drawing. So this ends up being the shape of the leg here. You know, this nice flowing shape. You can see that it's not a tube shape, but instead a shape with quite a bit of form to it. So if we understand those muscles and how they should be flowing, we should be able to get a leg of a good quality look to it. Also, even keeping in mind some of the subtlety of the overlapping of forms. This is something we've talked about with Bridgman. The overlapping of some of the lines when developing a contour to make some things look more three-dimensional. And this would be a case where we could have this vastus medialis overlapping the gracilis just a little bit when seen from a position over here. Or if we're looking at it from my angle here, if I were looking at the model, I might see the rectus femoris overlapping that vastus lateralis a little bit, and maybe having some overlapping of line there. So it's just giving more shape to the outer contour of the leg depending on which way you're looking at it. Keep in mind these vastus muscles, an important thing to note, the medialis and the lateralis, they're not just on the front side here, but they're actually sort of wrapping around toward the back. So that vastus lateralis is actually flowing toward the back side of the leg here. So we may be able to see it on both the front and the back, depending on our angle, and definitely from the side. And now we do have 2 muscles that are originating up on the pelvis and then running down the sides of the leg here that are sort of framing our muscles that we've talked about so far. And the first one is the tensor fascia lata, and we're going to see the tensor fascia lata originates up here, and then it's going to have its bulge here, but then it's going to dissipate into more fascia, hence the name fascia, as it dissipates down towards the side of the leg. So it's going to cross over the vastus lateralis and just run over the middle of it. And that's the sartorius. So sartorius is going to extend from around the same position as the tensor fascia lata and then run down toward the inside of the leg. Again, adding a little more form, a little more overlapping, a little more depth to that leg. Moving on to the back side of the leg, we're going to find 3 large muscles that are going to work to oppose our front muscles. Now, they're not as large and usually not as well developed as our front muscles. Why is that? Well, when we walk, we typically use the muscles on the front side of our leg, the anterior side of our leg, to lift our leg up. We don't need as well developed muscles on our backside to pull our leg back down. Gravity usually does the work of that quite well. So that's the reason why if you're going to be running or exerting yourself, it's a good idea to stretch out your hamstring group, that back set of muscles. Because if you don't, it's very easy to overexert them. So we all know the common name hamstring. Hamstring just refers to all of the group of muscles on the back of our leg. But what are the individual muscles? And how are they opposing the front side? Well, the muscles that comprise the hamstring are working our way lateral, outside, in, are going to be the bicep femoris, then the semitendinosus, and then sort of underneath that and a little bit to the side is the semimembranosus. So the bicep femoris, the semitendinosus, and the semimembranosus are the muscles that are countering the muscles on the front. Bridgman does a pretty good job at breaking these muscles down so that we can see sort of their overall shape. But if we imagine it kind of like, they almost look like, I don't know, pistons, or almost like chicken legs. And then, so this would be if we're working lateral on the outside. This is our bicep femoris, nice broad muscle. We have the semitendinosus here, and then underneath that, we have the semimembranosus. It's underneath that and a little medial. So this is our medial side. And you'll notice the muscles here, it's a better drawing there, the muscles are going to split as they run down and then run along the outside of the pit of your knee. So if you flex your leg and you feel those rigid tendons there on the outsides of your knee pit there, that's the dissipation of the bicep femoris and the semitendinosus running down and framing your knee there on the back side. So those are the three major groups of muscles that we're looking, or the three major muscles we're looking at. Over that, of course, we've got the glutes up here. So we have the glute maximus, glute medius, and then finishing out the lateral side here, we do have that vastus lateralis on the outside there. And then we'll be able to see also some adductors slipping through from the back side there. So that's the back of our leg. It's a pretty simple construction. The important thing to keep in mind is that we can usually see the bicep femoris fairly prominently. We can usually see the semitendinosus fairly prominently. And then we just have to check that the distal medial side for the semimembranosus there. But we are going to see them as very visible muscles. I think on the test there even is a question that asks the students to list the three muscles on the back of the leg that constitute the hamstring group, and list them either from lateral to medial or medial to lateral. So you do get some points for listing them, but I also want to make sure that you know which is which out of that group, because if we have the model up there and I say that your semitendinosus is not pronounced enough and it's making your leg look like a noodle, you need to know which one we're talking about there. So that's the back of the leg, fairly simple. The last thing we're going to touch on today is going to be the knee, which so happens to be my favorite piece of anatomy on the human body, mostly because it's got so much variety housed into one small area. We've got a lot of rounded forms and a lot of rigid forms, so it makes a good opportunity to do some drawing. The bone, associated with the knee is going to be the patella. The patella is this small kneecap, and that's what it is, the cap of the knee. And as you can see, the patella just rests right into the groove here at the distal end of the femur, and it's sitting right in front of the tibia, that shin bone muscle there. Now, if we start thinking about a knee, and we begin by drawing the patella, sort of this delta upside-down triangle shape here, we can start adding forms onto it to create the interesting complex variety of the knee. Underneath the patella, ensuring that the bone doesn't scrape too much against the tibia when we're doing our walking motion, are two small bursas. And a bursa is just a sort of a fluid-filled sac. You put B for bursa. That's acting as kind of a cushion underneath the kneecap. Beyond that, we could potentially see the distal end of the femur up top. And then underneath that, we could see potentially see the head of the tibia as well. So within the knee, we see all these interesting forms of a bone, 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 ridge, and then a bursa, two bursas there. So we have some curvature in here, and then some rigid bone in here. So the knee is going to have a lot of interesting shape to it. Keep in mind our vastus muscles that we talked about up here, as well as the rectus femoris dissipated into this tendon here, the common tendon of the patella. So it softens out a little bit there. But we can still potentially see these ridges here on the side, the ridges here of the tibia, and then the bursas and the patella. Keep in mind the patella only depresses the bursa when the leg is fully extended, meaning a knee cap or a knee area is going to have a lot more shape to it when your leg is straight out. When your leg is straight out, the tibia locks just under the femur there, and then the patella presses down on the bursa, sort of squishing them out, and so we see the form of the bursas and then the patella on top, and then the tibia and femur there as well. When the leg is bent, however, the patella lifts away, the bursas are not depressed, and the edges in general tend to be quite a bit softer as well. So you're going to have the most variety in a kneecap when the leg is extended and not bent. There's some interesting drawings in Bridgman that will describe the knee. You'll kind of break it down sort of like a diagram like this, and then apply that knowledge towards the creation of a drawing that he has of an actual, well, more like an actual kneecap, showing a lot of the interesting variety of shadow shapes and line quality that can exist within a very small area. So that's it today. That's the entire lecture. We've just got the pelvis. To recap the bones in the pelvis, we have the ilium with the iliac crest. We have the ischium in back, the pubis in front, of the sacrum is the tailbone. And then we're looking at the femur. And on the femur, the visible bony projection is the greater trochanter on the side. Just distal to the femur is the small kneecap called the patella. Muscles we're looking at on the pelvis, on the back side we have the gluteus medius, top here, gluteus maximus, being the bulk of your bottom. On the front side we've got a big broad muscle, the rectus femoris. Lateral we have the vastus lateralis, capping around the outside of the leg. We've got the vastus medialis running along and having the bulk on the distal end. Surrounding those we have the tensor fascia lata originating up here on the pelvis and then running down along the side. Dissipates into fascia, which crosses over the vastus lateralis through the middle. The inside is the sartorius, running along and framing the vastus medialis. And then along the inside of the leg is the gracilis, running straight on down. We have a set of adductors, 6 potential muscles that you'll see along the inside of the leg. Not very common to note those though, but you may notice some shape there, and it's important to indicate if you do see it. Moving on to the backside, there's the hamstring group, which is the lateral, the bicep femoris. Then more medial is the semitendinosus, and then the semimembranosus. Those dissipate into tendons that run along the backside of the knee. The kneecap is comprised of bony ridges of the femur, bony ridge of the patella, bony ridges of the tibia, and then the bursas as well. And that's it.